Trump's HIV cuts are devastating California's Black and Latino communities. So the 1.5 billion in federal funding cuts will shutter testing, outreach, and housing programs, while one LA nonprofit has already lost more than half of its budget. So why am I talking about this? I saw 3 commercials this past weekend, and today, by the way, is MLK Day in 2026, and I'm going to share with you a little story. When I was a teenager, I remember in the 80s seeing a lot of people afraid. This was during a time when people learned of the disease HIV and AIDS, and they were just being made aware because of all of the deaths. There were like a lot of deaths. It seemed like every week somebody you knew or somebody that you knew that knew someone in their family was dying of AIDS, and that was before they got all of the treatments that they have now. But I think what was very scary was, you saw all these commercials for awareness. That was a good thing, but all of the deaths that followed, because it seemed like it came too late of the awareness. And I think a lot of people just were not really knowledgeable at the time about the effects of the disease. That like it seemed like every 5 people that you met, somebody was infected with HIV that eventually turned to AIDS because of not having, the education and not having the medication to prolong their lives. And I remember being a teenager, the young people and young adults are influenced by, the music world in so many ways, and they have a platform and they can reach people from a long ways. And many young people were influenced by music artists such as people are today, but in so much so that a music artist, if you heard them sing songs, you really listen to the lyrics and you learn what those lyrics were about and the messages that they sent. And so there was a particular group called TLC and T-Boz. I recently saw a commercial that it scared me, because it brought back the memories of what happened back in the 80s when they did not have the medication. And I said, why is T-Boz, and we're all in our 50s, we're almost close to being senior citizens, and I'm like, why is she doing commercials about sexual awareness again? Why are they using her? And it hit me. And I know I heard people say that Houston had a resurgence of HIV and some other states, Atlanta, Georgia. So I started doing my homework and looking online. And the biggest communities in terms of racial background and makeup that have the highest percentages of HIV resurgence is Black and Latino communities. And so the first thing that popped into my head is the lack of awareness, the lack of education. People are not really checking for it because they figure that the medicine is going to keep them living longer, or they're just not aware that the seriousness of it, like how it was in the 80s, because they don't see people dying. Well, I thought again. I said, that death could happen again. But this time it could be not because of just lack of awareness, it's lack of funds, lack of money for communities that are Black and brown. So, which brought me to this article talking about the HIV cuts. I mean, the Trump administration has cut a lot of the benefits like SNAP, A lot of these housing programs, mental, people that have mental issues, their programs, different programs for different people in these communities. So what's to stop them for cutting the resources that people need, like medication, treatments for HIV? It could start this whole snowball effect all over again, where you'll have a new generation of people dying of HIV that eventually turns to AIDS because they simply don't have the medication, or they can't afford it, or the funding is being cut for those programs. So that led me to these articles, and I'm seeing them. And I don't think people are aware that this could happen if it hasn't already started. And so it says the $1.5 billion in federal funding cuts will shutter testing, outreach, and housing programs, while one LA nonprofit has already lost more than half of its budget. And so this is a recent article. It was in December. That's not that long ago, of 2025. So this is by Michelle Zacarias. And so we have a lot of new young adults and young people who think because the medicine is out there. And I even heard a couple of years back, and I'm going to share this along with this article, that people who were homeless and struggling were on purpose getting infected with HIV, because it was said that if you get infected with HIV, you get benefits like housing and food and some of the things that I just mentioned. But what if those things are cut? What if you can't get the medication to live longer? Then what? So it says this story, it was originally published by Gallo News. So the HIV testing, it takes a few minutes and it's free. What if they don't make that testing free anymore? What if you have to pay for it? What about people who don't have any medical insurance? So I'm sure that they're getting some type of funding to keep these programs open. But what if they start cutting these programs altogether? So public health advocates are bracing themselves as the Trump administration rolls back of recent federal cuts that take effect in the fiscal year. And that means all the way from October the 1st, 2025 through to September 30th, 2026. That's how it runs. That's all the way into our new year. So it says under the fiscal year in 2026, the budget proposal, the Trump administration is scheduled to eliminate more than $1.5 billion in HIV prevention and surveillance programs at the Center of Disease Control Prevention. Okay, so it says programs that previously funded testing, outreach, and education throughout California will be deeply reduced or shuttered entirely. So some of the most disproportionately impacted demographics will be the Latino and the Black communities, as well as the LGBTQIA plus individuals. So in California, HIV cases are most prevalent among gay and bisexual men, who account for a majority of new diagnoses, and the people living with HIV, according to the reports by the CDC. So thanks to federal initiatives, HIV has been steadily declining over recent years. That's because of the medication and the funding they are getting for these programs, and a lot of people have been allowed to be, fortunate enough to get medication to live longer. I remember when they didn't have any medication, so I lived through that, seeing friends, people I knew that I had went to school with that died of AIDS. So I guess that's why I stay I must admit I'm a recluse. So I really don't trust a lot of people, because people will say things. It's not about what they say, it's about what their behavior is and what they do. And so I lived through a lot. I've seen a lot. So you don't get this age to not know anything. But It goes on to say that thanks to these initiatives, they've been steadily declining over the years, but the treatment options such as antiretroviral therapy, pre-exposure, which this new thing they call PrEP, and I hear some of the young people in their music, they always use some of these terms in their music. I've heard young people say, oh, if you just use PrEP, well, what if you no longer have the luxury of using those medications anymore? And you can't just use PrEP, and you can't just use clean needles and different things like that. So the preventative public health education, that's what it is. So these are treatments, these are the options that are out there. But it says to address the stigma surrounding HIV, the federal government has made investments to improve access to care and for communities that are disproportionately affected. But this effort aligns with the national trends and is influenced by various social and structural factors, of course. So you see here at HIV testing center, results can be seen within 1 minute. So they can tell you if you're positive or if you're negative. So what if those things are not readily available? Those, luxuries, which really they shouldn't be luxuries, but under this administration, everything seems like basic needs, your living expenses, housing, food, things that should be basic needs that should be readily available are now becoming luxuries. What about health? We already heard about people's health premiums going up under the administration. So what about this? This is crucial. And I'm seeing T-Boz in her 50s, and we're all in our 50s, and she's doing these same commercials again for PrEP and all of this, trying to get the awareness out there again. That means we have a resurgence of people that are getting infected, unfortunately. So however much work was still left to be done, according to the Associated Press, it says overall HIV infection rates, they declined 23% in 2012 to 2022, but KFF Health News Associated Press analysis found the rate has not fallen for Latinos as much as it has for the other racial ethnic groups. But it is a really big deal, especially since many of our clients already struggle to navigate the healthcare system. So look at what's going on right now. Just think about all of this and think about what's going on, the deportations, the ICE raids, all of the stuff that's going on, people getting shot, the protests that are growing, the anger that's spilling over into the streets, and some of the other hard-pressing issues that are going on currently in our lives today. So it says it's a really big deal, especially when many of the clients are struggling to navigate the healthcare system. So this is Giovanni Botticelli, a development associate at Being Alive LA. So in California, Latinos and Hispanics are being tested more than any other racial community. So Botticelli said that regarding their clientele, he confirms, however, the black populations are the most impacted across the country. So Being Alive LA is a nonprofit organization created and operated by people living with HIV and AIDS currently. So the organization has already begun to feel its impacts of cuts that are taking place. So there are cuts that are starting, you guys. So all these young people that are going out, this hookup culture is what I call it. Watch yourself, because what is here today may be gone tomorrow under this administration. And it may take a lot to even try to reenact these programs all over again after all this is all done and over, if it ever will come to a cease. Because right now we're under, I would call it a regime, but we're under an administration that has cut a lot of funding in a lot of places that you wouldn't believe. And this is not anything new right here. I'm not surprised, but it's very eerily scary. Because what it's saying to me is signaling we're going to have a resurgence of people getting HIV and not getting their medication, maybe not able to get it, and there could be more death. It could start all over again. So, Being Alive LA is a nonprofit organization that's created and operated by people living with HIV and AIDS, and the organization has begun to feel its cuts, the impact of it. So, Botticelli told Callow, which the news that their employer was part of a county-funded program called EHE, which is ending the HIV epidemic. So EHE was a federal effort launched during the first Trump administration. This was in 2019 when that came into effect, and aimed at reducing the new HIV infections in the U.S. So the initiative targeted a specific group, priority jurisdictions, which included 48 counties in the U.S. with the highest number of HIV diagnoses, but currently being phased out. Okay? So I believe that we lost $120,000, he says. So according to Botticelli, the organization previously received an approximate of $190,000 annually to support the program and the services. So, they need funding to keep these programs going. And if with funding being withheld, which recently I was hearing Trump was going to cut funding for all of the what he would call sanctuary cities, and California, Los Angeles City, and all of the LA County would be that, and any of the blue states would be that, and he's going to hurt them, with these programs being cut. So for those that don't read and don't really think things through, and they just kind of live vicariously without really understanding the seriousness of what's going on, what you think is easy to achieve today, and that you're going to be here forever, and that you're going to get your medication, and you're going to be able to do this and that and the other, under this administration, he's making that a whole nother thing that you have to consider. Is it worth it? Is it worth going and hanging out and meeting people and living vicariously without worrying about, if I get infected, I'm not going to have any medication and I could die. You could die of anything, but who wants to die of this? Simply because you didn't have the medicine. And then not only that, just a lack of awareness and a lack of education of what's out there, and not really being serious about your health. And your health is your wealth. So it also goes on to say that now they're getting close to a little over 90. It says not even 90, but 38,000. So you see how it went from 190,000 to 38,000. So they made cuts. So that means less and less people. So this was in January to May, but we're dropping down again. They lost another 8,000, so it's now no longer 38,000, it is 30,000. That's where it dropped to. It's going to drop even more. That means some people are not going to be seen. They're not going to get medication. They're not going to get help. They're not going to get resources. Or they're going to have very little resources to help people. So there's a significant difference in other organizations that are part of the EHE program, and the county is also being affected in the same way as well. So in 2026, the budget will also eliminate funding for programs like housing opportunities for persons with AIDS. That's called HOPWA. Abbreviated. So this program, it provides housing and supportive services for low-income individuals that are infected with HIV and AIDS, and their families as well. So as a result of living with that disease, HIV and AIDS, who are homeless or at risk of becoming homeless will be most affected. So this also exacerbates a larger housing equity problem currently faced in California. So the budget cuts could have potentially devastating consequences according to HIV advocacy groups. So the decision has been scrutinized as an ideological equivalent of eugenics, a policy choice that will disproportionately harm and in many cases abandon the people most at risk. So that So these are basically the facts, and I'm just, don't shoot the messenger. I'm just giving it to you like how it is. I mean, it just brought my awareness up because I lived through that time when they made this big quilt, and it was all the families, our friends and people, loved ones that were affected because they saw a loved one or somebody that they were related to die of AIDS. So they had this big quilt, and the quilt was so big, y'all, they had to put it in a football stadium and lay that quilt out, and it was growing. I imagine that quilt won't even fit in the football stadium, if it does at all. I don't even know what they did with that quilt. I never really thought to look at it again because it was such a nightmare to see all of the people that were dying and succumbing to this disease. But what brought me to this article and the seriousness of it is that I'm not as young as I used to be during that time, and I saw that much death. But to be now a person that had seen that and learned from the experiences of others, and I also worked in a hospital, and so I saw people die of AIDS. To see young people who don't listen and who think they know the world go out there and make those mistakes, it's devastating. Because just from not having the knowledge and just from being naive and assuming that medicine and benefits are out there is not enough. You need to be aware because everybody's body's not the same. I also learned that everybody doesn't catch it the same way. Sometimes they're unfortunate. I remember reading an article, a woman, she went to the dentist and caught HIV that eventually turned to AIDS, and she had a lawsuit. She won the lawsuit. Of course, she wasn't alive to live to enjoy the money that she got from that lawsuit, because that's how bad that disease was at the time. You didn't have the medications you do now, but now with these budget cuts and this administration, it might be a resurgence of not only the HIV, we see that happening, but a resurgence of death. People just not being able to have the resources because of the cuts. So if the cuts are affecting the SNAP benefits, they're affecting the Section 8, they're affecting all these other programs, you gotta think it could affect this one as well, which it has already started. So you need to take this stuff serious. I know maybe people don't know too much about me, think that I'm just shooting off the breeze, but I'm being real here. Trust me when I say I lived to tell about it, to see other people dropping like flies. And that wasn't a good experience. It was death all around. You didn't know who had it. And there was fear all around because you didn't know where it came from and who. This was in the earlier stages. But now we have a more awareness about this disease and how you can get infected. But there have been some fluke incidences where people got affected because they're a drug user. You don't have to just be sexually promiscuous. It's people who went to the dentist and the dentist wasn't cleaning the tools properly. People who might have went somewhere and they had a cut on their skin, or they got in a fight with somebody who was infected and now their blood got on you or got in your eyes. You can get it in your eyes, you can get it in your mouth and saliva and all that. A cut in your body and you rub against somebody else with a cut. In hospitals you could contract it. So being a nurse and a doctor, they're high risk environments. So there's other ways of getting it. It might not be as high a percentage, because of the by way of transmission, but it's not uncommon and not impossible that it couldn't happen. It could happen. I think what raised my awareness too even more is when I saw that lady go to the dentist. And when you're in the dentist, you're thinking everybody's clean in all these facilities. But just think about going to a restaurant when they don't clean the utensils well. Going to a dentist when they don't clean those instruments and they're digging deep down in your gums. if those things are not sterilized completely, somebody was infected, they put that in your mouth. Now you're infected. You didn't even go out there and get it. Like sleeping with somebody, you got infected at the dentist's office. So it's a lot of things. Tattoos. A lot of young people like getting piercings and tattoos. If they don't clean those instruments well, you can get it like that too. And they were warning people about that. You can also not only get HIV, you can get hepatitis. So a lot of people were just not aware. They're not aware of the seriousness of this. And so I'm saying this to say this. Watch yourself. I know people are young and they think they know the world, but you don't know the world until you had an experience or you've seen others with experiences that you don't want to experience yourself, because you know what the consequences are, and they could be deadly. So a lot of people like to live on the edge. They want to live vicariously. You can live vicariously and be smart at the same time and be safe. Do it a different way. Think smarter. Not with ignorance. So just be careful and watch yourself. But these cuts also affect this right here. And so I was reading that some people think if I get it, I'll get benefits. I was reading about it. So, maybe I'll take it a step further. And I live in the state of California, so with California, and I'm gonna look at statistics, okay? So, and I'm just gonna do this really quick. I don't know, let me see. This is talking about it right here. So, care for the culture. Too often, stigma and fear get in the way of HIV prevention in communities that are disproportionately impacted by HIV, particularly Black communities, where the impacts is real and the convo is long overdue. So, you have a lot of young people who don't even check for this no more because they figure it's not going to happen to them. So, it says care for the culture is a movement rooted in love, truth, and keeping things real, zero shame, all facts, making sexual health part of a conversation, not a taboo. And so here is T-Boz. This is our anthem. So T-Boz is in her 50s. We're in our 50s, y'all. And she's doing these commercials again. This one is Let's Talk About PrEP. So check on your people. And so I was watching these commercials over the weekend and I'm like, why is she doing this? And I said, oh, it's a resurgence of the disease again. But this time I felt like going a step further and looking at the fact that Trump is the president and he's been making all these cuts. So I felt like, wow, we could see people die again. All because of lack of funding. Not because of not having the medicine. No, you have the medicine, but you're not able to get it because the funding is not there in the communities. Or you have less help. And so that's why we're seeing these commercials with my girl T-Boz. So yeah, I just wanted to show you that it is true. I'm seeing these commercials and they're popping up everywhere now. And I looked at TikTok. I sometimes listen to what the younger people are talking about. And I saw some young people talking about how Houston had in one weekend, more than 20,000 people that got infected with HIV. And I'm like, what are people doing out there? They just don't care or what? Maybe they figured, maybe they don't take it serious no more. Because, people got it in their head if there's medication and you could get the medicine, you don't got to really be scared about it no more. You can still live long. That's not good. That's not smart thinking. And then I heard a young person who was thinking with common sense. She said, nope, it's not normal. It's not normal. They're trying to normalize HIV. It is not normal. If you don't have it, you don't want it. So that probably would have been me back in the days because I was serious. Because I wasn't trying to go down like that. So I get it. But let me see here. I was trying to go into this. If I don't find it, risk and side effects. I mean, you could look at it at your own leisure. The impact of HIV on blacks, HIV in the United States, HIV statistics by race, CDC HIV statistics. I mean, you could go down the list. There's so much information out there. It's not even funny. I mean, you could look at your own leisure. I mean, it may not be something that I have to necessarily look up, but it is here. What I will say this is the two groups that are most highly affected, it says, is black men, black women, and then black and Latino communities. Those are the people that, the groups that are more vulnerable and affected. And and here, right here, this was May of 2024. It says African American people and Hispanic people are particularly affected by HIV, making up about 70% of estimated new HIV infections in 2022. That was in 2022. Now we're in 2026. So I would believe now what I'm hearing, this was last year. I heard that Houston had like an explosion of HIV cases. And I bet that number has grown now. So that's why we're seeing so many commercials with T-Boz. And, in that group TLC, they would promote like sexual awareness, sexual health, being safe, and all of these things. And so now what groups are under attack under this administration? We have LGBTQIA people are under attack. People who are transgender are under attack. People who are in the gay communities are under attack. There no longer protections are being lifted. People who are in black and brown communities are being attacked. And now we have white people that are liberals or who speak out truth to what's going on are also now under attack. So I mean you can get it if you're like somebody that sees your blinders are taken off and you see the truth of what's going on and you're made aware and you're trying to speak the truth and you're trying to bring awareness to things that are injustices or things that might save communities or bring awareness to communities, you're somehow under attack, So I thought I would make this video because I felt like this was something that needed to be heard and put out there, because I don't think people realize that there is a resurgence of this disease, and this could be devastating, like it says, for not only California's black and Latino communities, but all of 50 states if you're experiencing this. And what I'm hearing is there's a lot of other states that are going through similar issues where they're underfunded for these programs, or they don't have a lack of awareness of what's going on. And so I noticed everybody was freaking out when they cut the SNAP benefits and when they cut the Section 8, and then right now you hear them talking about housing affordability crisis. Well, we got another crisis that nobody's talking about, is HIV cuts. That is a crisis. And with this new group, everybody's talking about black love and hooking up. Ain't nobody gonna be hooking up if they don't know about this and they're not safe. You can hook up, but you might not be together for too long if you don't have your stuff together and you don't know what kind of resources are out there, or they cut your resources altogether in these communities. So I'm gonna let this go, but y'all be careful and take care of yourself, because I don't think a lot of people are really checking for this. But think about it, use your noggin. If he's cutting all these other programs, he might cut these programs, and it has already started. It says, look at how low the funding went down. They listed it out for you right down in here. Said the funding had just dropped. They had 120,000. Then it went from 100. It says they lost 120,000, and it was approximately they received 190,000 annually. Then it dropped from 190,000 to 38,000, and then it dropped from 38,000 to 30,000. What do you think it might drop to in 2026? Now he's talking about cutting more of these programs, because you know what he's gonna think? Hey, why are we going to give all this money to these people who should be responsible for their own sexual well-being and health? We didn't take a gun to their head and tell them, don't sleep. You sleep with this person and don't sleep with that person. You do this and do that. Don't have sex with this person and, be with this person. So think about it. This is out there. This is out there. And so if he cuts the funding for all of this, we might see people dying, not because they're dying because, they got regular health issues. They're dying of AIDS again. We're probably going to see a resurgence of that. That's the unfortunate part. And think about the people they said that are homeless. How do they get their resources and their medication? So think about that. And he's cutting the homeless housing funding. He's cutting the mental funding, people who have mental illness. He's cutting funding for all of these much needed programs. Why wouldn't he cut these programs as well? He's not going to leave them in place, because in his mind and in this administration, they're thinking, hey, you guys are adults. Why do we have to help you, when you should have common sense? But does everybody use the common sense? Do they think like that? No. And especially if they think there's medicine that's readily available. And we've been too busy. Those people have been too busy talking about, we got medicine that'll make you live long. I think that's where they messed up. Stop telling people that. Because what if you no longer have that medicine for everybody because of these budget cuts? Think about that, y'all. Things are not going to be the way they are forever.